Dr. Ghatan, please explain us what's the difference between a filler, there's that word of filler out there, fillers, and then there's the word Botox out there. I mean, to a layman like me, it looks like you're filling things, you're putting things in it in both ways. Tell us what the difference and why and when they're used.
Well, fillers are injectable material that are used to, for example, correct the nasolabial lines, or to improve the lips, to fill in some scars, to fill up the malar pads here, to make cheekbones more prominent. Botox is derived from botulism toxin, which is injected to the muscles, and it paralyzes these muscles so that there's lack of movement of the muscles. So the wrinkles, for example, on the forehead, in the glabella, and around the eye, they disappear. And that works for about 4 months, the effect. It takes, it works within a couple of days to about a week or so, and it lasts about 4 months. The fillers are a whole different bunch of things, and some of them last 6 months, some 12 months or so. There are some that are a little bit longer lasting, but we find that the ones that last 6 to 12 months are ideal because as we age, our bony structures, our collagen and the fat and everything else change. So if you have one area fixated, say if it's silicone, which is a permanent filler, and as we age, then other parts don't age together, we look disfigured. Because of that, we prefer to use fillers that are not too long lasting. Right. That makes sense because if you have something in here which doesn't change and the rest of it changes a little bit over, let's say, 3 years, and once we get 40, 50, 60 or whatever, probably things change much faster than as a younger person. So you don't want to have that gap. So a filler who lasts 6 to 8 months, 12 months, so then it goes away. So as the body changed, you never really saw the difference too much. And at that point, it can be refilled the way one needs it? Sure. Of course. Indeed, people come in every 6 months or so. Sometimes they even come for corrections. They want to have a little bit better correction. They come the next week or two or a month or so, and we put in some more fillers and get better corrections. And we work with. I try to work with the patient, and I give them the mirror. I start doing the filling and then show them, and then we say, okay, you want a bit more here, a bit more there, and we work together, and it comes out much better that way. Sure. Now, so basically a filler has a different function than Botox. Botox paralyzes the muscle, filler makes it, fills it up where it's missing. Right. Okay. All right. Well, wonderful. Okay, and is it sometimes that people might use a combination, like a little Botox here, which you seem to be saying that this is one of the best areas to put it in to get rid of those frowning wrinkles or whatever they are, and put like fillers also in it? Is that also a possibility to have a combination? Oh, sure. Yes. In fact, we do offer that to the patients because each part of the face or other parts of the body would require different kind of treatment because what we have available does different things for different parts. So yeah, we do use combination of fillers, Botox, and laser at time to get the ideal, picture. Right. Wonderful. Well, I even heard you saying on another video that Botox can be used to perhaps prevent sweating under the armpits. But for people who are interested to go to that section, they obviously can. Well, thanks a lot, Dr. Ghatan. Speak to you soon.